Good evening and welcome. My name is Julie Philbeck, and I'm the Chief Nursing Officer here at Research Medical Center. So I appreciate everybody joining us this evening as we come together to really talk about something that I think is a topic that we need to be able to discuss more openly, right? There's a lot of information that's swirling out there. And tonight, our goal really is to kind of get to the facts, to understand more about what potential donation really looks like and what that process looks like for a patient and how we provide compassionate care to any patient that may be within our organization at Research Medical Center. So I have some amazing team members that I want to introduce to start with. So why don't we have everybody introduce themselves? Kartisha, you want to start with introducing yourself to our team?
Yes. Hi, everyone. I'm Cartisha Hudson. I am a mother of an organ donor, Christopher Hudson Jr., and I'm happy to be here. Yes.
I'm Dr. Anthony Harrington. I'm a neurologist by training, stroke neurologist specifically, and the neurology medical director at Research.
Hi, I'm Naftali Presser. I'm the surgical director of the Transplant Institute at Research Medical Center.
I'm Dana Buckmuller. I am a nurse here in the ICU at Research. I'm a clinical nurse coordinator. Some of you might recognize a turbocharged nurse on nights, and I've been here for next month makes 29 years.
Well, before we dive into our panel discussion, we actually invited Kartisha to be here to really share her experience and share what that's like from a firsthand perspective of someone who has a loved one who is on that other side and who has made the gift and has been a donor. And so, Kartisha, if you'd be willing to share a little bit about your son's journey and your journey as his mom and family, and what that really looked like for you from a donation perspective, we would really appreciate to hear that story.
Of course. My son, his name is Christopher Hudson Jr. He was killed in a road rage incident in 2017, um, May of 2017. A few months before he was killed, he was getting his license because he was a late bloomer. And so he was getting his license, and we went there, and he asked me, he was like, Mom, this says, do I want to be an organ donor? Like, he was asking me, should he be an organ donor? And I told him, I said, Chris, that's a decision that you have to make for yourself. And it was a no-brainer for him. He was so giving, so loving and kind. And he just was like, yeah, I'll do it. Not knowing a few months later he would be an organ donor to 7 people. He was 19 years and 2 weeks. He died a few weeks after his 19th birthday. Basically, we were a happy family, a family of 5, 3 boys and my husband and myself, and he was the oldest of the 3 boys. We didn't really understand or know what organ donation really was because it wasn't something that was prevalent in the African American community. It was like, I saw it on the my license information, and I was like, "No." And, that's just how I was until, um, Chris passed away, and we went through that process here at Research Hospital. And one of my biggest fears was that, they don't work hard to save your loved one's life. And even though, that is a silly fear, it was a fear of mine. And in that process, Chris, they worked very hard to save his life. And unfortunately, he wasn't able to make it, but he was able to donate um, to 7 people. And I actually got to meet one of those people who received his heart. He lives in Kansas City, and we are very close friends to this day. And it just makes me feel like my son even though he's not here, he is living on through others, and his ultimate sacrifice saved someone else's life. And that's just who he was. And I'm not surprised that happened that way. I'm sad that he's not here, but I'm happy that he is able to continue the gift of life. So that is a little quick synopsis of our story and Christopher's story. Yeah, initially.
What a hero. Thank you. Thank you for sharing Kirsta's story. I sure appreciate that.
Thank you so much.
Awesome. All right. Well, at this time, I'm going to move into a couple of panel questions that we'd like to share. And I think for those of you that are here tonight, while we are going to maybe start some of these questions with an individual on our panel, this is really meant to be an open dialogue amongst all of our team members. Each person on this panel is very unique to what their role is in this process and their perception and view of it. And so that's why we invited such a diverse group tonight. So my first question, Dr. Harrington, I'd like to start with you. So one of the things that I think to level set and start out tonight is really explaining to our audience about what happens in the hospital when we know that we have a patient that has consented, or family maybe has consented, or the process of them becoming an organ donor is. What does that look like?
Yes. So first of all, thank you for having me here. So my role as a neurologist, I'm often in these kind of like end of life discussions. I'm involved with kind of prognostication if there is any brain injury or anything like that, or after a cardiac arrest, I help with that. And what it looks like, I mean, the short answer is, regardless of organ donor status or anything like that, that might be, on a driver's license or anything like that, it makes no difference in our treatment or our effort that we give or like the decisions that we make. Our goal is always to provide the best quality care possible and do our best to get people back to functioning, meaningful lives. Um, Sometimes, we reach a point where no matter all the things that we do and all the things that we try to reverse, it's not looking like things are reversible and things are either there's a catastrophic injury or things are just not improving after a reasonable amount of time. And that's when we start kind of shifting towards, well, if this patient could talk to us, what would they want? And that's really important, is that patient autonomy. Like, if they were able to speak for themselves, what would they say? And that's what I asked the family members. How would they want us? And what's a quality of life that would be meaningful and impactful to them? And that really guides the care. What the patient would want, what the family would want. We weigh in all this stuff, and that kind of guides us. The other part is, when we reach that kind of endpoint where it's like, there's nothing else we can do. Unfortunately, some patients, we can't save everyone. And it looks like no matter what we do, that's going to be the case. And that's when we have those conversations and what they would like. Do we want to shift our focus to comfort care as we talk about it, where we're focusing on making sure that they're not feeling any pain or anything like that as they transition to the end of life, to death? Or they don't show any signs of brain activity, which is, another part that I specialize in, I guess would be the best way to put it. But if there's no evidence of brain activity, that is considered a medical legal death, just like if your heart stopped outside of the hospital. So these are the kind of things where we're looking at the end of life. So that's kind of like my role into it. And I help guide families through this, because when we reach that kind of limit point, like for me personally, the way I approach it is, it's no longer just the patient that I'm taking care of. It's the family that I'm taking care of, who have never had these conversations, who've never had, anything like this happen before and don't know what to do. Like my hope is to provide the support, give them the objective truth, not sugarcoat things, to tell it unfortunately like it is, and what to do next. And, I try to stand by that. The whole donor thing, we make it at research and everywhere else in the HCA hospitals or any hospital that you've been in, honestly. We make that division where, all the life-saving care, end of life, and then all the donor stuff comes afterwards. Like, we have no kind of like, communication. I know Dr. Presser outside of work more than I know him inside of work. You know what I mean? So that's how we kind of do that kind of division thing, so we're not influenced in any way.
Yeah, I'll just piggyback on that a little bit. I think just to highlight that point, I think the key thing from my perspective is I am nowhere to be seen. I have no role at all in the management or care of any of those patients. The way, I mean, on a global scale, the way donation works often are those donors who are being seen at research may or may not actually end up at research. They may end up at KU or in Nevada or wherever. But I have no role in those patients' evaluation, their care, their workup. I am just basically, half the time I don't even know that they're undergoing those workups, just because I'm not part of their care team. So why would I know? I think that's an important distinction, just because we want to emphasize that there's a separation between any kind of the post part where we put the organs in, and that whole and the donation part and the evaluation part, they are distinct entities in their entirety.
I appreciate that. I think that's an important piece to recognize that truly, and I think that's often when we talk about misperceptions about donation, is that I think that there's an often thought process that those two work hand in hand, and they really don't, right? And there really is a clear separation. Dr. Harrington, I really appreciate that you talked about our priority is to talk about goals of care for what the patient would want. And donation may eventually be a part of that, but it's not what is the guiding principle of how we have those conversations. So thank you for that. My next question is about, and I think we talked a little bit about this, and Kartisha, I really appreciate that you shared your own personal perspective on this, especially through Chris's journey, is that you maybe had that thought process of would the quality of care be affected if he was a donor, right? So once that care team finds out, because we do, right? We do find out from the driver's license and what we call our first person registry, would that change the course of care for how we care for a loved one? So actually, I'd love it if you maybe share your impact in that. And then Dr. Harrington, I'd love to turn it over to you after that.
Yeah, like I initially said, I was in that fear because it was a abrupt thing that had happened to our family, and we just didn't know what to do. And but it was made easier because Chris did sign his own donor slip, and throughout that process, the care that was after the fear of me being scared about what was going on, after that process, the process throughout that was amazing. Everyone was very caring. I didn't feel like my son was just a number. I felt like he was a person. And throughout that whole process, every single thing was explained to us, what was going to happen next, what would happen throughout the process. And they just cared for Chris very well here at Research. He was cared for very well. And it made us feel like we mattered. It made his life feel like it mattered. So that was a process that I did thoroughly feel comfortable with because we were in an atmosphere of uncomfortableness. So that did make our hearts feel comfortable, me and my husband and our other children. That was a good process.
If I could give advice to anybody who might be listening to this or anybody here, is to have these conversations. Like, you know, nobody wants to think about this. Nobody thinks it's going to happen to them. I don't think it's going to happen to me, but I don't know what happens on the way home. You know what I mean? So in order to honor our patients' wishes and what they would want, if we have it on paper or they've had these conversations with their loved ones, it makes it a lot easier, right? It's like, okay, they would have wanted organ donation or not organ donation. Either one is totally fine, whatever the patient wants to do, right? If they have these conversations, made it clear, like, we know what to do in these moments, you know? So, that no matter how old, no matter how young or anything like that, having those conversations before really makes a difference, in the moment. And I would say just to other healthcare providers, and as well as like advice I would give if I were able to, don't be afraid to be empathetic and put your feelings out there. Sometimes we get too rigid. The reason why I thought of that is like, I didn't feel like it was just a number. My son was just a number or anything like that. It's like, that part is really important to me.
Yeah.
It's because this is the most impactful thing in their lives, right? And being there for them, being okay with saying what's going to happen, giving some space for quiet afterwards and for feelings to be heard. That makes a huge difference, and it establishes the trust and rapport afterwards. That I've found the most meaningful. I'm in these heartbreaking situations all the time, and people are like, man, I don't know how you do that all the time. Well, when I focus and remember, and my mission or my perception is to be there for the family as well as the patients, and that makes it a lot easier. And when I'm able to share that part of myself with them and we go through it together, it makes it a lot easier on both sides.
Yeah, I agree. If I could piggyback off
Yeah.
of him really quick, about him saying the emotional side, because it is a very emotional situation. And like you said, you don't expect something like that to happen. And in that process, when you're going through that and your mind is like scatterbrain, seeing your child there, and there's nothing you can do about that situation. But it was the love and care that we received from the team at the hospital that made the situation easier for our family. And even afterwards, it tweaked my brain to say, I need to find out more about this. I need to really, truly understand this because my son ultimately helped 7 people, and I want to know how I could be a part of that. And so that situation, although it was, very hard for us and still is, the team made it better. The people made it better. And just understanding what donation was made the whole situation more comfortable for us to maneuver through that process. So thank you for your work. I appreciate it.
Thank you all. For just a second, I want to dive a little bit deeper into the same question. Dana, I'd like to ask a little bit from your perspective. You're one of our ICU nurses, care for um, donors once they come in, maybe as a trauma patient in Chris's scenario or many other scenarios. You take care of them before, as we're working so hard to maybe resuscitate, various types of scenarios to care for that patient. And certainly you have also cared for patients once they become donors. So, thinking about that myth that's really out there that maybe we won't respond as quickly or the care won't be the same. Tell me a little bit about, from your nursing perspective, being at the bedside for that entire time. What does that look like from your end to continue to advocate for truly the life saving measures before maybe there is that chance that unfortunately we can't save a life?
Absolutely. I can't tell you how many times when a patient comes in who is so sick, it doesn't matter to us whether or not somebody is an organ donor or not. That's not our focus. Our focus right in that moment is caring for that patient as absolutely hard as we can. For the actual patient, for their family, that's all that matters in those moments. Um, our nurses and doctors will fight to the end to take care of the patient as best as possible. Um, I would describe our team as um, they're like mama bears. They will give everything that they have. They will protect that patient and their family. Um, we do partner with Midwest Transplant Network, and they're amazing at what they do. We work very well with them, just as all the hospitals in the area do. But those nurses and doctors, what they care about in each of those moments is, are we doing everything we can for that patient in those moments until the very end? And when we're in the very end and we are having some of those conversations, um, we'll partner with Midwest Transplant Network. But as Dr. Harrington mentioned, it's two separate entities, and we separate that out. And we will continue to care for that patient, their family, for as long as we need to, and in every way that we can.
Yeah. Thank you. I appreciate that. Maybe Dana, I'd like to stay with you for just a minute and think about another question and talk about a little bit about how our providers are notified, right? So often when I think about a patient comes in, um, right, we're working so hard, whether that be surgical intervention, medication intervention, whatever it may mean to save a life. Until, again, as you stated, a lot of times that the consent or the desire to become an organ donor isn't even something that is discussed or thought about. And so we're working so hard to try to save that life at that point in time. But let's say that we've progressed past that, and now we recognize that maybe we are truly at an end of life scenario. Um, Once that decision has been made for the conversation with the providers, how does that work in terms of the notification? How does everybody kind of come together to know whether a patient is truly what we call first person authorized? Or if not, what does that conversation look like with families?
So absolutely. When a patient comes in, again, our focus is not on whether or not they are an organ donor. Again, we're there just to care for that patient. But we're also trained to watch for clinical triggers in a patient. If they are progressing to a point where we might be looking at end of life discussions, or even close to that, there might be a potential. We are required by law to actually notify Midwest Transplant Network. In other states, it would be a different organ procurement organization, but for us at Midwest Transplant Network, we are required to notify them. Um, and even in that moment, we still don't know if they're a donor because it's not for us to know. We just do what we're supposed to do, and Midwest Transplant Network will just kind of follow in the background, update occasionally. But we continue to care for that patient. Even when it comes to the time where we are reaching potential end of life and maybe having some of those tough discussions and notifying families, our duty then is to bring in Midwest Transplant Network and have them here because we still want to make sure we're having that separation, and having the appropriate people make those discussions or have those discussions with the families. We're still constantly there as a team to support that family and still obviously care for the patient, but only really at those end times is it that we might actually find out that they might be first person authorized, because it's not our focus.
You know, you actually, we've been talking a little bit about first person authorized throughout our conversation tonight. And I'd love to have just a little bit more dialogue. Dana, if you could maybe start with this. So, share with the group really what first person authorized really means. And if I'm a family member, I'm a loved one of somebody who is a first person authorized donor, what are my rights within that? And what can I do or can I if my loved one is a first person authorized donor?
Actually, in our area, of course, we have Missouri and Kansas on both sides of the state line. It means that your decision to be a donor is just that. It's your decision. It's something that you a decision excuse me, a decision that you make, that we as a hospital are bound, as a care team, are bound to protect. We are there to respect your wishes, to do what you want to do. That is actually something that I believe it's still the case, but I know for the longest time since this came about that the attorney generals of every state vowed to protect as well. That someone's decision is just that; it's their decision. But it kind of also goes back to the previous conversation that it's so important for just as you to make that decision, what is right for you, to really talk with your family, those that you love, and share that decision with them. Because even if it is your decision, it's so much easier for the families if they know that ahead of time and can realize that and accept it instead of just in this heat of the moment where they're facing their worst possible moments of maybe losing you, losing their loved one. That's a horrible time to find that out, if they've never had that discussion before. So really important to talk with your families about what you want.
Thank you. Thank you for that. Dr. Presser, I'd like to turn to you for just a little bit. We've talked a little bit about first person. I think everybody on the panel has mentioned about how important it is to really have that conversation. So tell us a little bit about maybe your thoughts on how do you approach that? How do you really engage that conversation? How do you make sure that others have the knowledge that maybe that is your desire and wish?
So I think there's a couple of ways to approach that. So anytime you have a very difficult decision and that you're going to make and that you're going to communicate to your loved ones, it's sometimes easiest to find a specific time or venue to do that, whether that be, and for each person, when, depending on when they're making that decision, it may change. So for example, the most commonly under known way of kind of having a first person authorization is by your driver's license, right? So you get your driver's license. That's the first most obvious opportune time to start that discussion. Now, some people may not be in the position to have that discussion, especially if they're getting it when they're 15 or 14, 16. And also that may evolve because what we think when we're 15 is not necessarily what we think when we're 30 or 50. So I think it's important to find kind of dedicated times, whether it be dedicated points like when you get your driver's license to have that discussion, or whether it's something you discuss at, and you have an end of year discussion of various things, or whether you have it around birthdays, or like have some time marker to bring up those discussions, those hard discussions. I mean, the important discussions, nobody, especially if you're uncomfortable with it to begin with, you're not going to want to have that. And so you're going to try to avoid having it because it's hard to talk about and think about hard things. So creating a way and a structure for that, and to also just to make it the norm to discuss that, to make it not so hard and be like, oh, you talk about this with your friends at school, like you talk about what shoes you're going to wear to, prom. That should be part of just the general vernacular, so it's not so hard. And also, I think the other thing is that being clear about what organ donation means for you is important, in the sense of, while we think of it as a black and white dichotomous thing that you are either a donor or you're not a donor, there can be nuance to it. So as I was mentioning in a previous discussion, I had once a patient who, because of their particular philosophies, they did not want to donate their heart. They would donate everything else, but not their heart. Fine. Just as long as we know that, that's great. So if for some reason that you decide you want to donate, but maybe you have your own version of what you'd be comfortable donating, that's great. And it doesn't have to be dichotomous. You can specify that. So you do have to be a little bit more proactive so that it's clear, because often if it is a first person based on a driver's license, it'll be kind of more generic, all or none. But if you want that nuance, there's ways to do that. There are actual forms that exist out there, which, like, I myself have filled out a similar said form. So it is something which I think the easiest thing is, one, make it a common discussion. Two, find specific timelines to have that discussion. And three, make sure you're having it regularly, not every other day, but like at various important time points in your life, so that people realize if things have evolved.
If I real quick, yeah, and that kind of brings up the point, ideally, right, the suggestion is filling out a living will or advance directives and all these things, but like pragmatically speaking, that doesn't happen a lot. If it does, great, that makes it real easy. But to have these conversations with your loved ones, so that if you're unable to speak for yourself, they can speak for you. Like, I know my son, he was a giving person, like that's in line with what he would have wanted. So, beyond donation, like having these discussions, like what would I consider a good quality of life? Like what would be a meaningful quality of life for me? Everybody has their own definitions of that and opinions on that, and all of them are valid, right? But if nobody knows, then nobody can respect them, right? So, as he said, the DMV one, it's an all or none, make a decision in the moment, yes or no. It's a little cavalier, I would think, but it is a way, right? But if you do have any hesitancy, I would say, make sure if you have some nuance, you're like, well, I don't know about this, but I want to find out more, having that written out, or at the very least, a discussion with your family to speak on your behalf.
No, I appreciate that. Dr. Presser, I'd like to turn back to you. So we've talked a little bit about the ways in which maybe you can be registered right through the DMV or through those living wills, those types of things. But there's other ways to support organ donation efforts, right? And in particular, as a transplant surgeon, I think about the Miracle of Our Living Donors and that program as well too. Can you share maybe a little bit about how people can be involved in organ donation, even if it's not registering necessarally from the first person perspective?
So that's a very good question. And I think there's a lot of different venues that takes. I've had this discussion come up with patients who they didn't think they could be a donor because, they have this medical problem, that medical problem. Like most of the people I take care of aren't exactly healthy. Some of them are, but many of them are not. And so there's a couple key ways. So one you mentioned, in like the best case scenario is if you are healthy enough to be able to share via living donation, that is like the best opportunity, because it's the best quality organs, the patients do the best. Not everybody can donate. So it's, it's not like it's the only venue, but it is certainly a great way that some people can involve. The other thing is a lot of people, they find their donors through various groups, church groups, Facebook groups, all these different venues for how you can work with population is the wrong word, kind of exposing the fact that there's a need is kind of key. And I think the other thing to keep in mind is actually helping the recipients for donation is every recipient, they don't get through it themselves. Like they need a strong support system, whether that be friends, whether that be clergy members, whether it be family. It's really all of the above. Some people have some people don't have the other, and nobody gets through these processes by themselves. It does not happen. So having that strong support from whatever your network is a great way to support kind of transplant and donation, even if you're not directly donating, but you're helping that process along so that the benefits can be seen from the act of donation.
Great discussion. I appreciate everybody for this. So, this is my final question, and I'd appreciate it if each of you could chime in. So, Kartisha, I'm going to start with you. My final question is, if you had one thing that you wish everybody knew about donation that maybe is often misunderstood or is out there as a misperception or a myth in the world, what would be that one thing that you wish everybody could know?
I'll go back to what I said at first. If you're sick or if you're in that position where a family member is not going to make it, you feeling that they won't work hard to make sure that they're healthy. That was a misperception for me, and I learned that's not true. I mean, after the process of my son, me and my husband, we did a lot of work with the donations and learning about it and speaking about it. And it was good for me because I did have a lot of misconceptions that, oh yeah, and me being African American, oh well, they're not gonna work hard, and even though that is a myth, but people do think that they're not gonna work hard or not gonna help my child or not gonna help me or whatever the case may be. I learned that it's not true. That is a myth, and it did help me be able to communicate that to others in my community and be able to communicate that to everyone that I come in contact that had questions about donation and the importance of it, how it is to help someone else if you're not going to be here to live, to help someone else live on. So that was one of the myths I had, making sure that my son was cared for well, or if I would be cared for well in that instance, and realizing that it is important to communicate that to everyone and educate yourself with others about organ donation. So that is one of the biggest misconceptions for me.
Thank you. Yeah, I would say one of the biggest myths that I've heard speaking with families and people is, oh, the hospital just wants your organs.
Yeah.
That's the way it's put bluntly, and that is definitely a myth. Our goal is to treat a patient and to save a life, to restore function, to help as much as we can. If we get to the point of end of life, then afterwards, it's within the patient's wishes and the family's wishes to donate, and somebody else gets help beyond it. That's just like I find out, every once in a while I find out a couple months later, and I'm like, oh, well, that's great, good to hear. But otherwise, that's not in our framework at all, or frame of mind at all. So I'd say that's the biggest myth I would love to dispel.
I think for mine, for me, what I would say it's maybe not misunderstood, but maybe just not quite realized is, there have been probably over the course of the recent past upwards of 1 million transplants done in this country. Chances are, somebody who's had a transplant. You may not know they had a transplant, but you probably know one, or your friend knows one. And I have the blessing of getting to see the other side of this. That I'm the one putting the organs in and like taking care of them as they recover and as they have these new organs and go out to their new lives. So that's obviously I get one angle from it, but I think the big thing that people should realize is that this is not just like, it's not that we're trying to get this. These are going to your friends, your neighbors, your community members who are getting these organs and who are getting this extended life and extended, opportunity to experience life through these gifts. So, just sometimes we lose track of that part because we don't see it as much.
All right. I just want to say that nobody dies so that somebody else can live. Nobody is that important. Out of devastating injuries occur, catastrophic illnesses happen, and despite all of our best efforts, the important thing to remember is that in those horrific moments, that life could be given. And it's a selfless gift, whether it's a decision made by a person themselves or their loved ones. What matters is the gift.
I appreciate that. And, I would be remiss if I didn't pause after all of you just shared amazing insight and pause to think about. We've talked a lot about organ donation in particular. And at the end of life, there's also opportunities when we talk about tissue and cornea. In my time as a nurse and serving at the bedside, I was honored to be able to care for many donors who chose that gift. And, we've talked about it so many times that you never know when maybe that flip side may be there. And about 8 years ago, I had my own battle, unexpected battle with cancer journey, and found myself needing tissue and tissue donation to be able to make it through my surgeries. And never, as I was in my 20s caring for patients at the bedside, did I think that that would be something that I would need and how it would impact my life. So sometimes we only think about the big things when it comes to donation: a new heart, new lungs, new kidney. Sometimes those smaller gifts are just as profound and impactful. So it certainly is about the gift. Well, I appreciate the time from all of you this evening, your candid conversation, and really trying to make sure that we're educating our community and those around us about what the process of donation and the gift of life truly is, and also what it isn't, and making sure that no matter how a patient may present to our organization or any other hospital for that matter, our goal is always to save that life if we can. But there are times in which we can't, and what are those options when it comes to that? So I really appreciate the dialogue this evening. Thank you all very much for your time. And I hope that our audience and other team members maybe learned as much as I did tonight. So thank you all very much.
Thank you.